when I hear a patient say to me, I want MAID, I actually hear them say, Dr. Buchman, my life is intolerable, help me. That's my cue to go in and investigate their intolerable suffering in all its domains. Physical, like pain, nausea, vomiting, psychosocial, cultural, the loss of being the caregiver or the breadwinner of the family, and of course spiritual and existential suffering. So it's a key, and in assessments of any part, it's not just, oh, you want MAID, here you go. No, it's a deep investigation and addressing of their intolerable suffering. And loneliness, social isolation, many of these things are key, and particularly with marginalized people where they're suffering with poverty or they're having housing, they're in a housing crisis, what have you, food insecurity. Yes, we do see that. Those absolutely have to be addressed. And it's incumbent upon clinicians to begin to get all the services, mental health services, counseling, everything in place, whether it's a track 1 or not. These things are common in the illnesses that we see. And as an assessor, I'm not granting eligibility on the basis of social isolation or loneliness or poverty.
Well, that's what I wanted to check. If somebody comes to you and says, I'm desperately depressed, I'm lonely, I don't want to live anymore, I want MAID, are you granting it under those circumstances?
I'm not granting it under those circumstances until I've assessed if they meet the eligibility criteria. And remember, it's again about autonomy. That patient actually has the right to refuse. They can be depressed, but if they have the absolute capacity to understand and appreciate their situations, then they have actually a right. I might do my damnedest to try to get them that mental health care that they need, but they actually have a right to refuse if they have capacity to make that decision.